Hi, my name is Stephanie and I'm a speech therapist with Verse Therapy, and I wanted to talk to you about the scope of practice for speech language pathologists, or speech therapists as they're commonly known. So I have always felt like the term speech therapist really is not a great term for what speech language pathologists do, because we do so much more in our scope in the way we can help people than just the speech and language that they're producing. In general, a good way to kind of think about speech therapy is if you need help with speaking, communicating, even non-verbally with things like AAC or sign language or other modes of communication, any mental thinking and clarity, memory for cognition, problem solving, anything kind of above the shoulders is a good way to think about the skills that speech therapy can help you with. I wanted to go through some points that are common areas that speech therapists can be helpful with. So we're called speech language pathologists, so we'll start with speech. Speech is the act of producing speech sounds through this very intricate system. I always say it's a miracle that anybody can produce speech. It's such a complex process. So speech language pathologists work with speech development to develop speech sounds that we call phonemes, all of the sounds that our mouths make to form meaningful words and sounds together. We also target disorders including childhood or adult acquired apraxia, which is a neurologic motor planning condition. For speech, we also target speech fluency, which is more commonly known as stuttering or cluttering, when words don't flow as smoothly as somebody might want them to in a fluent, cohesive manner when they're communicating. Speech language pathologists also target language, and language is kind of broken up into expressive and receptive. Expressive is what comes out. So we, as speech language pathologists, look at grammar, word structure, sentence formation. And then on an even higher level with expressive language, we also can target things like professional communication skills. How are we using our expressive communication and our expressive language to connect with others? Because that's really what it's all about. The other side of language is receptive language. So receptive language is what we understand and comprehend. With children, this can be developing receptive language skills through play-based activities to expand their concept knowledge and awareness. For adults, oftentimes receptive language intervention comes if somebody is having maybe a cognitive decline with something like dementia, or if they had a neurologic event like a stroke or a traumatic brain injury. And speech therapy can target receptive language to, again, same as children, build concept awareness and really put together language that they're receiving from others. It's also really important to recognize that communication and speech does not have to be verbal to be valid. So speech and language can also be produced via alternative methods, like an AAC device, which you might see people using out in the community, out in public, where they have a tablet or a talker where they're selecting buttons or using eye gaze technology to communicate with those around them. There's also sign language as an alternative way to communicate, gestures, and even things like grunting and pointing. Those are all really valid forms of communication, and we should never be pushing for one mode of communication and not accepting what a patient is giving us, because as speech language pathologists, we value all forms of communication. So outside those areas of speech, language, and alternative communication, speech therapists are really experts in other areas as well that's not encompassed by our name of speech therapist. So speech language pathologists are also experts in swallowing and feeding disorders, and that can be for both children or adults. With adults, a lot of the time you can have swallowing difficulties following a neurologic event like a stroke or an injury, or sometimes just from the aging process can decrease your ability to chew and swallow. And that can become a choking risk, or it can lead to something called aspiration pneumonia, which can be really, really devastating for your health. So swallowing therapy from a speech language pathologist can be really beneficial as a preventative measure to make sure that you don't develop those things. For feeding therapy, it's a little bit different with children. Some children need the swallowing component of feeding therapy, but a lot of the time, speech therapy or feeding therapy from a speech therapist can be really beneficial for children who are more selective eaters or have sensory processing differences that make it really hard to try new foods, maintain a balanced diet, or maintain even a small inventory of their preferred foods. And by building trust with a skilled feeding speech therapist, you and your child might be able to make really good gains to expand their diet. But the number one priority for me as a feeding therapist is not to eat more food, but to decrease a child's distress surrounding food and meal times, so that going into a situation where they might be exposed to new foods, it doesn't cause them a high level of distress. They have the skills and resources to be able to regulate and refuse the food if they don't want it, but also build skills to trial the new food or engage with it, and so it's not as distressing. So far, speech therapists can target speech, language, feeding. We also can target cognition, which are skills like memory, problem solving, executive function, and attention-based skills. Speech language pathologists in our scope of practice also target voice. So this can be a wide range of voice disorders that speech language pathologists may be able to help with. This can include gender affirming voice therapy. It can include voice rehabilitation, or just something called vocal hygiene therapy for people who are at more prone risk to chronic laryngitis or developing vocal nodules. There's actually even more in the speech therapist scope of practice, but I thought I would give you guys that list of just kind of other ways other than speech and language that a speech therapy evaluation might be able to help you.